Hey everyone, welcome to MedHeads, where we dive into the health stories that matter. Today, we're talking about a class of drugs that are supposed to help, but for some people, they've caused serious, life-altering side effects. These are dopamine agonists, commonly prescribed for restless leg syndrome, RLS, and Parkinson's disease. They work by mimicking dopamine, the brain chemical linked to movement and pleasure. Sounds harmless, right? Well, not exactly. Some patients, mostly women, have reported compulsive behaviors like uncontrollable gambling, excessive shopping, and even risky sexual behavior. And the worst part? They were never warned. Let's break it down. First off, restless leg syndrome is no joke. It causes this intense, irresistible urge to move, especially at night, making sleep nearly impossible. Imagine feeling like you have to move or your skin is crawling. These drugs, like ropinirole, help by calming that sensation. But here's the catch. They don't just affect movement. They also hit the brain's reward system hard. That's where things get dangerous. Some women who took these drugs found themselves acting completely out of character. We're talking about people who never had a history of risky behavior, suddenly engaging in compulsive sex, excessive gambling, and reckless spending. And not just a little bit. One woman, Claire, told the BBC she started leaving her house at night, wearing see-through tops and looking for sex with strangers. Another, Sarah, had zero interest in sex before taking the medication. Then suddenly, she was selling explicit videos online. And then there's Sue. She went from never gambling to racking up 80,000 pounds in debt. The worst part? These women had no idea it was the medication causing this. So what's happening here? Dopamine is the brain's feel-good chemical. It's released when we do something rewarding, like eating, winning a game, or even getting a compliment. These drugs mimic dopamine, but they can push the brain into overdrive. Instead of just helping with movement disorders, they can trick the brain into craving more pleasure and ignoring consequences. That's why people on these meds describe feeling like they couldn't stop themselves, even when they knew what they were doing was harmful. It's estimated that 6 to 17% of patients on dopamine agonists develop these compulsive behaviors. That's a lot of people, and yet most doctors aren't warning patients about this risk. Now, here's where it gets even messier. Drug manufacturer GSK knew about these side effects as early as 2003. Their own internal report linked dopamine agonists to what they called deviant sexual behavior. One case even involved a man who assaulted a child while on the medication. Despite this, warnings weren't added to drug labels until 2007, and even then, they were vague. Instead of saying, hey, this might make you do things completely out of character, the leaflets just mention an increased libido. There was even a class action lawsuit in 2011 where Parkinson's patients sued GSK for their gambling addictions and destroyed relationships. The company settled, but denied any wrongdoing. And here's the kicker. Some countries, like the US, now recommend these drugs only for short-term use. But in the UK and Australia, they're still commonly prescribed long-term. So if you or someone you know is on dopamine agonists, what should you do? First, don't panic. Not everyone experiences these side effects. But if you've noticed impulsive behaviors, whether it's gambling, shopping, or sudden personality changes, it might not be just you. Talk to your doctor. In many cases, adjusting the dose or switching medications can help. And most importantly, spread the word. So many people suffer in silence because they feel ashamed or don't realize their medication might be to blame. Medications can be life-changing, but we deserve to know the full story before we take them. Thanks for tuning in to MedHeads. If you found this episode helpful, share it with someone who might need to hear it. And remember, MedHeads is brought to you by meducate.com.au, your go-to for healthcare courses and resources. Stay informed, stay empowered, and we'll catch you next time.